So this would be our continuation for the diarrheal lessons. So now let's proceed to the intervention to pediatric dehydration. This is for Pedia. First, here we have no signs of dehydration. So the diet should be age appropriate food, should be continued for children with no signs of dehydration, and fluids should be provided as tolerated. So reduced ORS should be provided after each episode of loose stools. So the amount of the ORS to be given according to age, if the child is less than 2 years old, that would be 50 to 100 ml. Then for 2 to 10 years old, that would be 100 ml. Then more than 10 years old, as much fluid as they want. Then for the low osmolarity oral rehydration solution, so remember, this is our aerosol or our ORS. Again, this is only low osmolarity in total of 245 millimole per liter with a composition of sodium, chloride, glucose, potassium, and citrate. So those are our main components for our low osmolarity ORS solution. It's 75 mmol per liter sodium, 65 mmol per liter chloride, then 75 mmol per liter glucose, which is anhydrous, and 20 mmol per liter potassium, then citrate of 10 mmol per liter. And the most important aspect or component of the ORS is, remember that it would be glucose, anhydrous. Potassium is used to replace the large potassium associated loss associated with acute diarrhea preventing hypokalemia. Citrate that is used to prevent or correct base deficit acidosis. Then for glucose, it is used to promote absorption of sodium and water in the small intestine. So 75, 65, 20, 10. Sodium, we have sodium, glucose, which is of the same osmolality here. Sodium and glucose, which are both 75. Then next with your chloride, which is 65, potassium 20. Then for our citrate, which is 10. Again, citrate is used to prevent or correct base deficit acidosis. Can total osmolarity would be 245. For our patients who cannot afford ORS or clients who will be going home who don't have ORS with them, they can make their own homemade ORS. So our homemade ORS contains table salt and sugar that can be made as follows. So number 1 here, we have water. Minimum requirement is clean water. It's only clean. 1 liter. And then 3 grams. It's only 3 grams of table salt, or equivalent to 1 teaspoon of table salt. Then 18 grams of common sugar or sucrose, which is also equivalent to 4 to 5 teaspoons of table sugar. That would be our homemade ORS. So how to give infants and young children using a clean spoon or a cup. Then for babies, a dropper or a syringe without needle can be used. Then for children less than 2 years old, it should be offered a teaspoonful every 1 to 2 minutes. Then for older children, that may be taken with frequent sips directly from a bottle or a cup. For mild to moderate dehydration, children with mild to moderate dehydration should be given the appropriate ORS in 4 hours, amount in ml computed by multiplying the weight in kilograms by 75. The weight is unknown. We have the standard required amount in 4 hours in terms of ml or milliliters. In less than 4 months, that's 2 to 400. Then 4 to 11 months, 4 to 600. Then 12 to 23 months, 600 to 800. 2 to 4 years, 800 to 1,200. Then 5 to 14 years, that's between 1,200 to 2,200. Then 15 years and older, that would be 2,200 to 4,000. Again, that's for mild to moderate dehydration. That would be shock. Dehydration with altered level of consciousness, severe acidosis, worsening of dehydration, lack of improvement despite oral and nasogastric through rehydration therapy, persistent vomiting despite appropriate oral or nasogastric fluid therapy, then severe abdominal distension, paralytic ileus, and glucose malabsorption. IV fluid for our severe dehydration, we could be using plain NSS or plain LR. For plain NSS, the components, we have 154 sodium, 0 for potassium, and chloride is 154. So equivalent sodium and chloride concentration in the normal saline solution or the isotonic NSS. For the LR, 130 sodium, potassium of 4, chloride of 109, and 28 for bicarbonate. But actually, our choice here for children would be both normal and sodium and plain lactated ringers. But if you will be asked for the better fluid for rehydration, that would be plain NSS or the normal saline solution. So for severe dehydration, all we need to do is to give a rapid intravenous rehydration. IV fluids are started immediately with hydration of 100 ml per kilogram fluids given over 3 to 6 hours. The fluid of choice is an isotonic solution using LR or NSS. Children with shock secondary to gastrointestinal losses should receive rapid of 20 ml per kilogram bolus of isotonic crystalloid solution, NSS or plain LR. Boluses may be repeated up to 2 times if necessary. Then don't forget to monitor the child as frequently as possible in order to prevent congestion. So for now, that would be all. Thank you.